couple of weeks to formalise terms of reference.
I believe we've got Lorraine's here now as a substitute. Yes, substituting presumably for David. Okay, that's helpful. So we've got a full team out then eventually, as long as Andrew Munir arrives. Good. So moving on terms of the agenda, we now go to the update on the GP out of hours contract, which is the main item about Camidoc, and we will ask Liz to introduce first. Liz.
Thank you very much, Chairman. Can you hear me all right? I seem to be a bit of a way away from my microphone. Before I start the substantive points that I wanted to make, I just have something by way of a preamble, which I hope is all right, and the reason for it will become clear as I go through it. First of all, and we have discussed this with the legal officer, we do believe that the legal comments, point 3 on the report, are a little inaccurate. And we're a little bit concerned that they've been included and actually reported in the press without being cleared or discussed with us. For two reasons. It's specifically the reference to a failure to undertake another procurement process. So there is a specific regulation, Regulation 4.1, Roman numeral 4, of the Public Contracts Regulations 2006 does provide for the possibility of entering into a contract without competition as a matter of urgency. Secondly, in fact, when we did the work around identifying an interim provider on an urgent basis, we did in fact work with the other PCTs in the consortium to develop a framework to identify potential alternative providers, and we undertook outline discussions with a number of alternative providers, and therefore we do actually feel that a mini competition and therefore a procurement process took place. So I would ask if that legal comment could be reconsidered in that light. Secondly, to remind everybody here that we are the commissioning lead for the out-of-hours consortium of 4 primary care trusts. That is NHS Camden, NHS Islington, NHS Haringey and NHS City and Hackney. We are their commissioning lead, but we are not responsible in Camden for services outside of Camden, and the out-of-hours consortium is not a legal entity. So the decisions around services outside of Camden continue to rest with the individual PCTs concerned, and queries relating to services outside Camden will need to be addressed to the relevant PCT. The other side of that, of course, is that we are the lead on behalf of a consortium, and the decisions that have been taken with regard to the out-of-hours contract are decisions of the consortium, that is the 4 PCTs working together. I'm about to go through and provide some information as you've requested. This may, there are a lot of quite detailed points that I'm going to make, and that is because what I would like to do is to address some of the inaccuracies in a very, very large volume of information that has been circulated within the GP community, within the media, and within the public in general. And there are some points that I think it's important to get across, particularly where we feel that there are some factual inaccuracies. And I think it's quite important that we have the opportunity to do that as I go through this, because some of the assertions are quite misleading and actually could undermine the service that we are commissioning and reduce confidence in the new provider to provide out-of-hours services. We actually have therefore circulated this evening a statement to GPs in Camden, and we've circulated it to the other PCTs in the consortium, which provides this information. Finally, and then I'll get on to my substantive report, you may be aware that the members of the consortium have been threatened with legal challenges and have received solicitors' letters. We therefore have to be circumspect and careful in terms of what we say, and in order not to prejudice any future legal action or to compromise any of the parties to that action. So I will have to be careful how I answer questions and how I phrase some of the information that I'm going to provide. But I did think it was important that we were able to give out as much information as possible on the matter that you've asked us to bring to you. That was the preamble that I wish to go through. Are you okay for me to start?
Liz, just on that one point, you did ask for our legal officer to perhaps vary or withdraw the remarks in the formal report that we've got before us. I don't know if, Ros, if you wanted to comment at this stage, so we get that out of the way.
In terms of the report, when I read the report, there was no indication that there had been a mini competition. And on the basis that there was a mini competition, that would comply with the rules and the expectations of the Treaty of Rome, in that it would be openness, transparency, and everyone was clear about the procedure. So on that basis, I would have no problems about that.
I've got a question from Peter, yes.
This concept of mini competition is new to me. I took this to be saying there were discussions with the other members of the consortium. I don't think she was saying that there had been any invitations to other companies or other organisations potentially providing supplies. So I can't really see how that constitutes a so-called mini competition.
Right. Can we clarify that? Actually, one of the things we'll want to explore anyway, I think, through this part of the agenda, is this sort of and the construct of this mini competition. So perhaps you can answer that, Paul, in terms of what actually happened when you thought Camidoc weren't going to sign this contract, or you weren't going to allow them to sign the contract. How did you go about finding this alternative?
Well, I think Liz will come through in a quite systematic and in a way that details the timeline of things that happened and address a number of issues. So I don't want to prejudice or spoil her pitch on what she's going to say. In response to Councillor Brayshaw's question, I can be quite clear. It wasn't just about discussions within the consortium. The consortium PCT set up a framework of assessment and did talk to a number of other potential providers of out-of-hours services. I can be very clear on that. In respect of the advice, I mean, we welcome, I think, the clarification from your legal officer. I have to say our assessment of the law still is, given that it's a moot point, arguably, that because we did do a mini competition, however, our assessment of the law still is that under that regulation Liz quoted, we actually had no need to, as it was a matter of urgency. However, we did do that mini competition.
So back to Liz. Do you want to carry on with your main presentation?
Thank you very much. So the areas that I'm going to cover are firstly the procurement process that we originally went through with regard to out-of-hours. Secondly, the process around identifying an alternative provider when the PCTs became concerned, had some concerns around Camidoc. Thirdly, the consultation processes that the PCTs undertook. Fourthly, some information around Camidoc's financial position. And finally, fifthly, some information on the cost of service provision, because there have been some quite detailed facts and figures around publicly, and I would like to provide some information and some accurate information on that. And finally, and last but by no means least, clinical safety and governance, as there has been an open letter circulated around the GP community expressing concerns around clinical safety and governance. Those are the areas that I wish to cover in this briefing. And some of this will be quite familiar because we have visited this committee in its previous incarnation and been through this. So apologies if what I'm saying is already known by many members of the audience here. So originally we instigated the procurement process, that is the 4 PCTs working together with Camden acting as the lead PCT, a procurement process for out of hours, to establish a new 3-year contract from the 1st of July 2010. And we had an open tender process in line with the other processes that we carry out when we tender, so an evaluation, looking at delivery model, clinical governance, patient access and price. And as a result of that process, in March 2010, Camidoc was named as the preferred bidder. This doesn't mean that a contract was entered into with Camidoc at that time, or that the procurement process was concluded at that stage. It meant quite simply that Camidoc were our preferred bidder. Subsequent to announcing or determining that Camidoc had this preferred bidder or preferred provider status, the PCTs were then prepared to sign the contract as it had been tendered. But Camidoc brought to the attention of the consortium a number of serious problems regarding their financial status. With the agreement and cooperation of Camidoc, the consortium commissioned an independent business review and concluded from that actually Camidoc at the 31st of May 2010 was technically insolvent. We also were concerned that their financial difficulties could compromise future service delivery in the short and in the longer term. So you can appreciate we had a difficult situation. The consortium therefore concluded that they could not confidently or safely ensure the continuity of the out-of-hours service by entering into a contract with Camidoc, and therefore abandoned the procurement exercise. We then sought to identify an emergency provider for a 9-month period to provide the services while we undertook another procurement exercise. And the service provision for this period is consistent with the service provided by Camidoc, so it is the same service, a different provider. We've contracted for the interim service for a 9-month period to cover the time to undertake a re-procurement. And the other aspect that we'll be coming on to, won't we, later today, is the white paper which was published in the process of all this. And we do know that should the white paper intentions go ahead, urgent care and out of hours falls into the commissioning remit of general practitioners, and therefore this 9 months would give the GPs the opportunity to clarify their future commissioning intentions with regard to urgent care and out of hours. That's my first bit on the procurement. In terms of the identification of an alternative provider, because of the difficulties that we had assessed and we had heard about from Camidoc, and as a contingency, the PCTs in early June 2010 took steps to protect the continuity of service provision in the event that Camidoc should be unable to continue because of its financial difficulties. Developed a framework which Paul has just talked about, which could identify alternative providers of out-of-hours services, should they be necessary, who would be able to mobilise quickly to provide services on an urgent, short-term basis. And then we undertook discussions with alternative providers without any specific timescales discussed at that time. The assessment framework that we developed resulted in a short list of emergency providers looking at a number of factors which were based upon the Department of Health's recent out-of-hours report, which I think you may be familiar with, and key service-related areas. We took a decision to let the short-term contract to Harmony on the 21st of July 2010, and we informed Camidoc that they would not be the ongoing service provider on the 23rd of July 2010. Camidoc also provide a number of other services to PCTs and on an individual basis to GP practices. We understand that Camidoc has served notice on these arrangements, and it is intended that initially Harmony will take over the delivery of those services to ensure continuity, but it is up to PCT commissioners and the individual GPs to procure the services in the longer term that are not directly related to the out-of-hours contract. Just a couple of words about Harmony. It has very similar origins to Camidoc. It started life as a GP cooperative with a belief in delivering a local GP-led, clinically safe service to its patients. It started in 1996 as a GP cooperative in Harrow in West London, and its two founding GPs are still active within the company. It's now large. It provides services to over 9 million patients across England, covered by over 20 primary care trusts, and it handles up to 70,000 calls per month nationally. Within London, of those 9 million, approximately 2 million of those patients are in London across 8 primary care trusts, including some of the most deprived communities in North West London. That was the process around the alternative provider and some information on Harmony. We've been asked about the requirements of Section 242 of the NHS Act 2006 with regard to consultation. And you may recall that when we set the service specification for the new contract for which Camidoc was the preferred provider, there was a consultation process under Section 242 to do that. Harmony is providing cover on an interim basis for a period of 9 months and providing the same service. There will be no changes to location, hours of service, methods of contact or the service telephone number. And we've had legal advice which has confirmed we did not have an obligation to consult under Section 242 around this 9-month interim urgent service, as there is no change in the service provision. The decisions around the appointment of the alternative provider, Harmony, were all taken by the consortium board, which represents the 4 PCTs, and upon which the 4 PCTs are all present. And those decisions were taken with the full support of the individual PCTs. And we've kept local clinical leaders involved, and we've asked for GP and links representatives to come onto the service mobilisation groups that we've set up. There's some information coming into the public domain around Camidoc's financial position, which was the key driver for the very difficult decision that the PCTs had to take around this out-of-hours contract. And as I've already said to you, some of the information around the financial position came clear to us after we've identified them as a preferred bidder. But actually earlier on, in December 2009, Camidoc did bring to our attention that they were experiencing financial difficulties with low reserves and having to delay payment of employer contributions to the NHS Pension Agency. The PCTs sought to work with Camidoc to help reduce the gap between its income and its costs. We believe that Camidoc expressed appreciation for those efforts. Those efforts resulted in an agreement that was reached in January of this year between Camidoc and the PCTs to increase the contract value over the remaining 6-month term of the contract, that's up to the end of June 2010, by a total of £400,000. Camidoc agreed to deliver some efficiency savings as part of that deal and confirmed that that these actions, that is the efficiency savings and the additional contract amount of £400,000, would provide sufficient funds to enable them to deliver a service through to the end of the contract, that is June 2010. The PCTs were not made aware at that time of the ultimate approach adopted by Camidoc in respect of the pension contributions, and specifically the employee pension contributions. And it was not until July this year that the PCTs learnt that Camidoc had been withholding employee pension contributions to the NHS Pension Agency, in addition to the delay in passing over the employer contributions. You'll be aware that with relation to people who work for the NHS, there is an employer contribution of 14% of salary in addition to the salary or the amount paid to the contractor, and then the contractor or employee themselves contributes 6% of their salary into the NHS pension scheme. Both those elements, we learnt in June, July this year, had been withheld. With the agreement and cooperation of CAMIDOC, as I've said, the PCT has commissioned an independent business review to provide all the parties with an independent assessment of CAMIDOC's financial position and their ongoing financial viability. And the PCT's concluded from this report that CAMIDOC was technically insolvent at the end of May of this year, and the PCTs also became very concerned around CAMIDOC's ability to deliver a sustainable, ongoing service. In terms of the costs, and again there are some very detailed figures around in the public domain around the cost implications of the actions that the PCTs have taken, we do of course have an obligation to ensure that we can demonstrate value for money across the services, all the services that we commission, and we also obviously have to ensure a safe and consistent out-of-hours services provided by the service provider that is compliant with the Carson requirements and the additional requirements from the Department of Health following an incident last year, a national incident not involving a London PCT. And this is irrespective of any difference between the organisational form of the organisation that provides the service. I would like to make it very clear, in response to some correspondence that's going around, that no sweeteners, special incentive payments or unjustified payments, and I'm quoting from correspondence that the PCTs have received here, have or will be made to Harmony. We are paying service set-up costs to Harmony on an open book basis because this service is going to be of a short-term nature. It's a 9-month contract, and you'll be aware that we had originally, through the procurement process, intended to place a 3-year contract. So with a longer-term contract, we would have expected those costs to be recovered over the period of the contract. With a 9-month contract, that's not possible. We estimate that the set-up costs for the short-term contract are £50,000 per PCT. And the monthly cost of the Harmony service is comparable to that of the CAMIDOC service. We have, based on information previously received by CAMIDOC, the PCTs have estimated the likely costs were CAMIDOC to provide the service for the 9-month period. We have estimated that those were likely to be approximately 20% higher than the current monthly contract value, and therefore more than the contract value agreed with Harmony. It would have been inappropriate, therefore, for the PCTs to contract with CAMIDOC for the 9-month period for the same reason that caused the abandonment of the original procurement, concerns about financial viability. I want to move on now to clinical safety and governance, because there is some worrying information being circulated around safety and sound clinical governance. And first of all, to stress that patient safety and clinical governance are of paramount importance to the PCTs and to the service provider. And as part of the selection process for the temporary provider, the PCT sought assurances around the robustness and appropriateness of the proposed arrangements. It's an ongoing requirement of our contract that adherence to clinical standards is maintained, and that is monitored very closely, and that is the case with the current contract and with the new contract. As I've already said, Harmony has a very large provider base already, with 2 million patients in London and 9 million across England. So we believe that they have the experience of providing out-of-hours services, and they also have particular expertise in taking over out-of-hours services in circumstances such as this. We have a very robust performance framework within the contract, which we will be following as we as we monitor the contract performance on an ongoing basis. And we have also invited local GP representatives to oversee the transition and the establishment of the governance arrangements over this contract. We recognise, as a point that's often been made by this committee, that local knowledge is key to the effective delivery of a good out-of-hours service. And in fact, eligible staff, that includes call centre staff, drivers, and the rota and shift coordinators, have the right to have their employment transferred to Harmony under the TUPE arrangements. And we understand that they are accepting this opportunity. And we believe this will assist in ensuring that the local knowledge is maintained. Harmony have also confirmed to us that they are committed to working with local GPs in the delivery of this service. And as I've said, all aspects of the service remain the same, right down to the telephone number and the location of the call centre and where the triage is carried out. The issue of training has been raised. The out-of-hours contract requires that GP training needs to be addressed in conjunction with the local deaneries, and we have already arranged meetings with the London deanery to discuss improvements in current out-of-hours training. There have been some specific questions raised regarding the provision of key equipment and what is carried in the cars by the doctors visiting patients to do the home visits. Harmony provides medical equipment, medication and full course prescriptions for patients when that is necessary. And actually it is already a requirement for self-employed GPs to provide a range of their own essential equipment, such as stethoscopes, blood pressure machines, ear and eye examination devices, and they're available to GPs through Harmony should they need it. Harmony also provide other equipment, this gets a bit technical, but for urinalysis, pregnancy tests, blood glucose meters and nebulizers, which are the treatment for respiratory difficulties. These expectations are laid out in our contract to ensure that there's no confusion. It is the case that Harmony has not to date, as a provider in North West London, provided oxygen or defibrillators in its London service because they work very closely with the London ambulance service. And any patient needing resuscitation and treatment through oxygen or defibrillators, which restart the heart, would be cared for by the London ambulance. Obviously, incoming calls are prioritised through the triage process, and there is a robust audit trail of that. So potential life-threatening medical emergencies would be dealt with by the appropriate emergency service and not necessarily by the GP out of hours. We do understand that the Camidoc cars carry defibrillators and portable oxygen. Although we understand there's never been any call for that equipment to be removed from the cars and used with patients. Harmony will continue to hold this equipment in those cars. They will ensure it is appropriately maintained, and they will ensure that all potential operators are adequately trained in the usage of this specialist equipment. Those were the areas that I specifically wanted to pick up. It's difficult to respond directly to individual questions for the reasons that I set out at the start of this brief presentation, but I hope that this addresses the key concerns. Certainly it addresses those concerns that have come to our attention. For your information, Harmony is looking to arrange visits to individual GP practices in the coming weeks, and we hope that that will provide certainly GPs a chance to understand Harmony and their organisation and their service provision in more detail. That is what I wanted to, the information I wanted to provide to you, Chairman. I know that you'd like to ask James to speak.
I'm sure. Thank you very much for that, Liz. I'm sure there will be colleagues who will to ask questions. Anybody want to start, or shall I go? I'll let Peter go first. Then he's got his hand up.
Thanks, Chair. I think for the first time tonight, I certainly have heard the figure of 9 months as the length of the interim contract. And it is being said that following that period, it will be GP consortia responsible for commissioning these services. My understanding is, from the white paper, that it will be another year, possibly even 2 years, before the GP consortia, which would only be set up even in shadow form after that 9 months period, would take those responsibilities. So in the meantime, who will be commissioning and on what basis is my first question. My second question relates to the statements that were made about Harmony. And I too have been looking them up on the internet and know their origin was similar to that of Camidoc, but I do believe, and correct me if I'm wrong, that they are now a very large multi-million pound, £70 million turnover organisation that is technically a company limited by share, with a share capital, and therefore there will be dividends payable to shareholders, and that its original origins, like Camidoc's as a company limited by guarantee and a cooperative, is not currently their legal status. So I'd be grateful for any comments on that. I think I'll leave it at that for now, Chair.
Just to add before we move on to the answer about the first 9 months contract and what happens afterwards, I understand as of today, rather than not 1st of October, that the contract started today, not on 1st of October. So does that mean 9 months from today, or does it now mean 10 months? When is the finishing time for the 9 months? Would be also helpful today, if you can give us that but also pick up Peter's other points, if you would.
Thank you. Who will be commissioning ahead of the implementation of the white paper? You're absolutely right. There's quite a long lead-in time. Mainly, no doubt we'll come on to this, because of the need for primary legislation, and quite significant primary legislation, to bring into being the proposals that the Secretary of State has made. But it is very clear that commissioning from now needs to be GP-led. So we will be working with our general practitioners, and the other PCTs will be, around the development of urgent care and out-of-hours strategies. But you're right that technically it is the PCTs until April 2013, as we understand it at the moment. But it's been very clear from what the Secretary of State and the coalition government have been saying, that they expect to see much more GP input into the commissioning process and the commissioning decisions and the strategic decisions. And quite understandably, our GPs are very concerned that they have an engagement now in terms of the decisions that we're taking, as they will pick up these things in the future. In terms of the origins of Harmony and its current form, I mean, I'm sure you're right about the 70 million. I don't have that information about Harmony, but the key issue is that we have an organisation that can provide a safe, value for money, well-managed, robust out-of-hours service, and that is what we are concerned about, rather than the organisational form of the organisation that provides it. In terms of the length of the contract, I'm going to ask Paul to answer that one, because he's been dealing with this directly.
It's very simple, Chair. Yes, it's a 9-month contract starting today.
Can we just ask, we initially thought it was going to be 1st of October. That was what was, I think, published at one point. It's now been moved forward a month to the 1st of September. Is that right?
I need to be careful with my response. We initially asked Camidoc to extend their current provision. Obviously, you just can't stop these things overnight, and we've worked, and credit to Camidoc for working very constructively in terms of the handover of services, and I'm happy to record that. We talked about a period no later than the 30th of September, and we've made it clear to Camidoc that, and at some periods, unfortunately, and not from the PCTs, but there were a number of dates floating around in the public domain. The PCTs were made it clear to Camidoc a little while ago now that we felt the 1st of September was the date for handover. So, I mean, I'm sorry if that appears to be confusing, but I just want to avoid that perception of brought forward. There's no perception of brought forward.
Okay, I'll bring in Maya next, who indicated. Maya, got a question?
As you probably realise, there's a very strong feeling in the area in Camden, I'd say, that an organisation like Camidoc is a sort of organisation that people would like to see providing these sort of services, and a not-for-profit organisation, an organisation that doesn't have, as Peter mentioned, shareholders, so it doesn't have to, I suppose, it doesn't have such a strong incentive to make as much profit as possible. So that's what people, as you probably know from the holes of discussion over the debate over the last year or so, is what I would have thought you would try as hard as possible to, keep in place. You've given us, I think, quite a good explanation of why you did go for an alternative alternative contract. But I'd like to explore that further because it is so important to everybody. So what I'd like to find out is what you actually did in terms of seeing if you could enter into maybe a temporary, a short-term contract with Camadoc. I know that you said, well, they were technically insolvent, etc., but would it not have been possible, what would the risks have been if you had entered into a short-term contract while Camadoc tried to resolve the situation that it was in? Was that possible or not? The other thing is, you mentioned that they would have been 20%, the cost would have been 20% higher, but then you mentioned that there were differences in the services that were being provided, so I wasn't really sure whether it was exactly the same thing that they had actually bid for, which brings us to some extent to this issue of mini-competition. I mean, did Camadoc, were they given the opportunity to bid in an open way for the same sort, on the same sort of terms as Harmony, or did that not really happen? So those are my three questions. Thanks.
In possibly not the same order as you asked them. Your first question is I think, relates to the organisational form question again, and we are blind to the organisational form. Our concern is that we have a provider who can provide a robust service. I think you may have misheard what I said. There is no difference in the service that Harmony will be providing there is no difference in that service from what Camadoc have been providing. It is the same service. It will be the same service, and we have estimated at an additional cost for Camadoc to provide it. Camadoc were not given the opportunity to bid for the same service for the interim period because of the concerns that we had around their financial viability and their ability to deliver, and that the compromise that may bring in future to a safe service. But the actual service itself to patients it's the same service that Harmony are providing as Camadoc have been.
Do you want to come back, Maya?
Yeah, I just wanted to check that. So was this sort of the legal advice that you were given that you couldn't actually enter into a contract with Camadoc? Or, I mean, because if there was an issue about, I suppose, I mean, if they'd entered into a contract with them, you would have expected that they would, in the end, be commercially viable. So if there was a problem at that point in time, surely if they had entered into what seemed like a lucrative contract, they would be able to provide the service.
Okay, so Camadoc, we believed, based on the independent financial review that we had carried out, were technically insolvent. And we believed that there were also their financial difficulties were such that it could compromise a safe service in the future. Therefore, we didn't feel that we could commission a short-term service from Camadoc or a substantive service from them. We also, as we are custodians of the public purse, cannot enter into agreements where we may have to put in additional funding on top of that already agreed to ensure that a provider keeps afloat when we have the opportunity to secure at a lower cost a service of equal robustness and quality.
Can I come in with my questions? I'll bring in, I've noted that Paul wants to come in as well later on, but I'm actually prompted as well from submissions I've received directly from colleagues in other boroughs who are also concerned about this contract. It does relate to the finances. So I will acknowledge the fact that David Winskill from Harrogate has written to me, as well as a question coming in from a councillor Victoria Ward from Hackney as well. But they both actually say the same thing, and I'm actually much the same worry, is that we heard tonight that in December 2009 you were aware all the PCTs were aware that there was a problem with the finances of Camidoc. That's what you've told us already. And at that stage, the 4 PCTs collectively put in some money at that point. By March 2010, though, it would appear that through the procurement exercise, Camidoc by that point was still a preferred bidder, and then by May, they were technically insolvent. It seems to me that if you knew there were problems in December 2009 requiring a bailout from PCTs to keep them afloat, and you knew at that stage in December 2009 there seemed to be an issue about making sure contributions to pensions were being paid, why didn't you clarify in March, when you were about to be a preferred bidder, that Camidoc had paid their pension contributions? And why is it that you took another 2 months to discover that they hadn't, and they were technically insolvent? It seems to me that somebody is not keeping a proper eye on the finances, either of Camidoc or NHS Camden. We'll ask similar questions to Camidoc in a minute. But it seems to me, I'm puzzled why Camidoc got into the position where they were still the front runner as your preferred bidder when you were aware some months earlier that there was a financial problem.
I think the key phrase here, Chair, is about the serious and ongoing nature of the financial problems. What the PCT says, and if I may be so bold as to some money, £400,000 in January, a significant amount of money, and it was accepted by Camidoc, as Liz has pointed out, at the time, that the combination of that cash injection within the terms of the old contract plus the efficiency savings would see them through to the end of that contract at zero financial balance. We walked away from those negotiations understanding that would be the case and that Camidoc would come out of that contract with a zero financial balance effectively. I wasn't involved in the tender processing, but the invitation to tender processes would have had exactly the same financial questions to all potential bidders. And as Liz has pointed out, that immediately after the award of announcement of preferred provider status to Camidoc, had Camidoc turned up to sign the contract, effectively on that day the PCTs would have signed. Camidoc, to their credit, outlined the ongoing and substantive nature of their financial difficulties at that point. So it is fair to say that this wasn't the first time PCTs were ever aware of financial difficulties within Camidoc. However, it's unfair to say that we knew about that all the time. We thought we had entered into an agreement that allowed those financial difficulties to be resolved.
Okay. Second part of my question is really about the procurement process, because in having a preferred bidder of any kind, you've gone through an exercise where you've analysed the quality of provision offered by the potential bidders. Camidoc clearly, as we all heard from several years in this committee, have always been well received by patients and seem to achieve all the quality standards that you would request. So on quality, they were clearly in the right frame. But over a period of the previous contract, the strike price per head seems to have varied very little in that time. Obviously, there's some inflation going on. What was the strike price in terms of the 2010 budget, going forward, in terms of the payment per head that was already in the contract? Bearing in mind this organisation was having financial difficulty on the old financial arrangement, how could you then agree a contract where the price per head may not have varied that much, and you knew there was an increasing capacity, increasing demand? Clearly, those conditions were only going to get worse, and Camidoc's finances were going to get worse. How could they still be regarded as a preferred bidder, bearing in mind those market conditions?
It's quite difficult to go into a lot of detail on this. Whether my colleagues in Camidoc are going to be able to provide or would be happy to provide detail, I'm not sure. So it's quite difficult to go into a lot of detail. But the new contract would have been funded on a different basis than the previous contract, and it would have been a lot more sensitive to the amount of activity that was carried out, rather than being based on a per head. So it was a different funding arrangement under the new contract. I've lost track of the second point that you asked, sorry.
Well, I'd assumed that it was, so you've already actually answered to a certain extent, that it was not a per capita basis on the new contract, and that it would be activity driven. Therefore, how would one establish what your budget is if you activities can obviously the demand can continue to rise at an exponential rate, as it would appear from evidence elsewhere that one of the problems that Camidoc was facing was an increasing demand on its services over and above what was possibly expected, and therefore they were losing money. Now, if the new contract was activity led, you wouldn't know what your price or how much you were going to spend either, because you wouldn't know how the trends in activity might change in the next 2 to 3 years.
Okay, I mean, as part of our procurement and financial planning, the PCTs would have done quite a bit of work on how it looked like the activity would go and how it looked like the costs would go. And I mean, that's part of the financial planning that you do around a procurement. Even though the basis changed from a per capita block to an activity basis, we would have carried out a great deal of modelling and planning and analysis to help us assess what the costs of the newly procured service would be. I'm sorry, I might not be answering your point, but I'm wondering if your question...
I'll just move on to one other point, which is you have acknowledged there is some upfront payment to help establish the harmony in its process of about £50,000 per PCT. Did I get that right? As an upfront payment to get them established. Where does that £50,000 per PCT come from, and how is it impacting on other services to make sure that the 50,000 is available?
Are you asking me where the £50,000 comes from for Camden? Well, it comes from our £500 million commissioning budget.
So you've obviously got some spare cash in the back pocket which you could offer £50,000 for. Because it's all extra expense you hadn't budgeted for this year.
Well, it's an expense that we needed to incur to ensure that we have a safe service. And it's our financial calculations, as I said in my presentation, led us to the conclusion that Camidoc costs would have been higher.
So the 50,000 is out of reserves, effectively, in your budget? Because you didn't, on the 1st of April, when you set your budget for the year, you didn't have this £50,000 allocated to Harmony. So you now have it allocated to Harmony. So it's come from somewhere.
Well, it's a common experience that there are things that aren't allocated that we find we have to pay for in year. And if, I can provide many other examples of that if you'd like me to.
I'll bring in Paul next, and then Adam.
Thank you. If you've got any other 50,000, you can bung them my way. The politician I'm most close to that's high profile is Vince Cable, and I was with him on Friday afternoon, and he has a phrase which I think is rather apt here, which is, it's a right Horlicks. And it seems to me that your handling of this in communication terms has been a right Horlicks. You complain about misinformation, factual inaccuracies, misleading, and I would suggest this is really of your own making, because you've created a vacuum, and into vacuums gossip and conjecture will follow. I found it rather shocking that I read Tom Foote's article about it. Was the first I knew about this, and yet obviously it has been going on for months and months. So my first point really is that I think you need to look at your communication processes, because that's what's landing so much anxiety at your doorstep. I hear what you say about the shortfall on pension payments, and I have some anxiety about have those pension payments on behalf of the staff in Camidoc been met, and I assume if they have, they've had to be met by Camden NHS. Similarly, you talk of 400,000 having been injected to arrive at a zero balance the 30th of June. Here we are on the 1st of September, and Harmony have been sprung upon, I guess, most of the people in this room, because I didn't know until I entered the chamber and read the briefing note that the service started today. It does seem that it's been a movable feast, the briefing that we've had. We've had 3 or 4 updates since Tom Foote's articles, one of which I think laid blame at the White Paper, and that was later rescinded. But I am concerned about the financial position in the period since the 30th of June, and whether the cost to your £500 million war chest is an extra incremental cost that you've had. I'd also, I'm reassured by you saying that the service will be the same. I'm sure all of us here in the room will be pleased to hear at least that. However, could you define the same service? Is it prospective that our local doctors will essentially provide the service for Harmony, or at least the majority of them, or will Harmony be bringing in doctors local to other London boroughs that they already serve? And finally, can I ask on behalf of the councillors on this committee whether you can and will share with us the independent financial review that convinced you of the insolvency?
Thank you. I'll answer specifically the question about local doctors and the independent financial review. I've listened very carefully to your other comments. Our Director of Communications, sitting behind me, I'm sure that she will reflect on your referral to, and I think you said a right, Horlicks. I don't think I complained, though. I think I commented at the start of my presentation that there were some factual inaccuracies and a lot of information, and I welcomed the opportunity to provide information to put some of that right. I don't think I complained. I didn't feel as if I was complaining. I hope you don't feel that I was. And I like the reference to the £500 million war chest. Which it was. Now, the staff that are employed by Camidoc have the opportunity to transfer over to Harmony under the TUPE regulations, with which I'm sure you're familiar. And we understand that those staff are availing themselves of that opportunity and will therefore continue to provide a local service. And as I said in my presentation, it is the same service from the same place with the same telephone number and as much as possible with the same staff. The arrangements with the GPs that work in the service is not that of an employee-employer relationship, so they are not covered by TUPE. It is a matter for local doctors whether they wish to work for Harmony or not. Obviously, we hope that they will wish to continue to ensure that their patients receive high quality out of our services by continuing where they have before to work for the provider, but that's a decision for them, not for us.
And the financial shortfalls? The financial report. I don't think that we, I mean, I would have to ask my colleagues in Camidoc their view, and also the authors of the report, before I could give an opinion about whether that could be made public. But I have told you the conclusions that the PCT's reached as a result of reading that report. And I asked you if there was incremental cost in the period between 30th of June and 1st of September.
I'm going to ask Paul to answer that, if you can, Paul. I don't believe there is, but...
Incremental costs through the continuation and extension of the service with Camidoc in the interim period.
We were told that 400,000 was to cover to a zero balance at the end of May. We've had 3 or 4 months since then. There's also the issue of the default on pension payments, which hopefully have now been paid. The pension payments issue you'd have to ask Camidoc about. The NHS Camden is not liable for those pension payments and will not be paying those pension payments. Is there an incremental cost for June and July? Clearly, based on our
duty to provide an out-of-hours service, it was absolute that we had to have that continuation of service for Camidoc at that point, as we couldn't mobilise an alternative provider. It would have also been, we understand, illegal for Camidoc to worsen their financial position while trading while insolvent. So we have had to provide, we have offered a premium over and above the contract price to allow them to trade and provide those services in June and July, so that their financial position doesn't worsen, but we have continuity of service. Yes. Sorry, it was the end of June, so it's 2 months.
I've got Adam on the list, and I'll just give a fair warning to the committee. We're well over time already. But Adam, next, this is questions to the NHS Camden. We've got to, don't forget, we're going to have Camidoc to give us their presentation and questions shortly. Okay, Adam next.
Okay. Thank you for your presentation. You mentioned the level of the service would be the same. You mentioned telephone number, locations and so on. Will it be the same in terms of level of staffing, both in terms of the number of GPs available and support staff available? Thank you.
Within the specification for the contract, there is no absolute requirement, as I understand it. Colleagues may wish to comment about the numbers of staff. As long as the provision of a safe and effective service is there, it's a matter for the service provider to ensure calls are triaged by appropriately trained clinicians, and that there is enough GPs to cover the demands and the service. I understand that as of today, Harmony have attempted to use the shift rosters as given by Camidoc, but if over a period of time Harmony, through greater efficiencies of service, can use fewer GPs, that's something that is a matter for them. Clearly, as commissioners and PCT commissioners, our ultimate goal, and we seek to assure ourselves constantly that a clinically safe and effective service is being provided. But in terms of if Camidoc have ex-GPs, Harmony must have ex-GPs at any one time. I don't think that's a matter for a commissioner. It's the provision of a safe service that's important.
We had that debate earlier in the year, if you remember, when we last looked at this, about the balance of different types of clinician that might be available and whether they'll all be GP trained or not. And I don't want us to reopen that wound, because it was the same wound was for the Camidoc service anyway. Can we move on to hearing from our friends from Camidoc, James Hood and Mayor Gore, who are come with us? First of all, to give us your presentation of where you think you are and what your take on what's happened over the last few months, and then there'll be questions of the sort that you've already heard, I'm sure, coming to you afterwards. But James, you're starting us off, are you?
Okay, thank you very much, Chair, and I'd like to introduce myself. I'm the interim Chief Executive of Camidoc, having been in post since April of this year. I was previously a Camidoc board member since November 2007, so I know something of the history. Dr. Maya Gore, who's on my right, is one of our executive directors, and he will answer questions, but he may chip in, but I'm going to do the main bit of the presentation. What I wanted to do was to tell you something about Camidoc. I expect those will be things that you already know, but they're things I want to emphasise. I'm then going to give you a few facts and figures, and I was going to write them up there, but I think I'm going to have to ask you to scribble them down, to hold them in your mind. I'm then going to run through the story, if you like, a bit of history, going back a little bit further than Liz Wise has. Then abstract what I see as the key points that I would wish you to take away from what's happened. And I have prepared a written briefing, which I wasn't able to table in advance, but that may assist in note-taking, because I'm going to cover mostly what is in my written briefing. The Camidoc, the first thing to say about Camidoc, I think everybody knows we're a social enterprise, and we're owned and managed by local GPs. We're staffed by local GPs, and we have a very strong belief that the way to deliver out-of-hours services is that the out-of-hours services are essentially services for patients of local GPs, and those local GPs are therefore the best people to decide what kind of shape and form and out-of-hours service they want. So we're owned, managed and staffed by local GPs, and we exist primarily to deliver those services. So if we're not delivering those services, essentially, there's no real reason for us to exist. We're not existing to bid for whatever comes up in the health world, to take over the world or anything like that. We're here to run local services in this area. The second thing to say is that as a social enterprise, we're driven by principle, not profit, and we are concerned, as is the PCT, to deliver value to the local health economy. And if we were in a situation of making excess profits, we would see that not as a good for Camidoc, we would see that as a loss to the local health economy, and we would actually seek to return, probably by a change of rate, some of the excess profit we're making. And in fact, as you go into the story I'm going to tell you, you will hear that in 2006 we did precisely that and reduced our rate because we were making, as we saw it, an excess profit. And part of the story will be that what we saw as an implicit contract turned out to be one-sided. I'll say more about that later. It's evident, and I don't think Liz Wise actually said this, but she said it in writing, that there have been none of this decision-making has been driven by concerns about patient safety. I'm sure she'd have meant to say that if she didn't say it. We're valued by our patients, and in a recent Mori survey, we came second in London, sadly not first, in terms of patient satisfaction. We're seen as a national exemplar for our clinical governance arrangements. So I think, one of you commented that Camidoc was generally well thought of, and I think we can put our hands on our hearts and say that's true. Turning to the facts and figures, the first number I want you to hold in your mind is 14. That's the number of years that Camidoc has provided services to some parts of Camden and some parts of Islington. Latterly, as you know, since 2005, we provide services across all 4 PCTs. There was some discussion about rates earlier, and Liz Wise said that she would want Camidoc's permission to disclose commercial rates. I'm quite happy to do so. In 2005, we were paid £5.45 per head of patient population. In 2010, the rate was £5.31 per head of patient population. We've also heard that activity, I think, Chair, you asked a question about changes in activity, and we've also heard that activity has increased over this period. In 2005, in the calendar year, we took just under 68,000 calls. In the last calendar year, for which we got data available, we took 103,000 calls, just under. So there's been a substantial increase in activity in the context of what is actually a slight reduction in income to meet that activity. As I said earlier, we're driven by principle, and one of our principles is that we won't compromise on the quality of our services. So in order to meet that increase in activity, rather than cut corners or attempt to send more people to hospital, we've maintained the same rates of keeping people out of hospital as we started out with. We've had to recruit more doctors and more call handlers. So the other facts and figures that I'd like you to pay attention to. When we started the contract, Camidoc, as a pre-existing organisation, brought just over 400,000 of its own money into the contract. In the first year of operation, we did pretty well, and it was as a result of that doing so well in the first year of operation that we were able to offer the PCTs a rate reduction to £5.25. The contract that was let in 2005 was for 3 years, and we're now in 2010. So at the end of 2008, which was the end of the substantive contract, we were in a healthy trading position. We still had well over £1 million in balances. However, even at that point, we were starting to use money heavily month on month, just because of the changes in activity and because of some additional investments that we made in quality of our services. And in brief, we've continued to lose money since that point at a rate now of approximately £70,000 a month. It costs us about £70,000 more each month to deliver the service to the quality that we want to deliver, that the PCTs require us to deliver, and that patients expect. And I would say that there are undoubtedly some things that we could and should have done to improve that, but that this basically is a service about people delivering services to people, and it is actually very difficult to find ways of compromising on costs without also compromising on quality. When we were faced in 2008 with contract extension, we brought to the PCT's attention our difficulties in continuing to deliver the same quality of service to the standards expected at the same price. And we've, over the years, since 2008, we've made at least three substantive requests for increases in rate. On only one of those occasions did we actually receive an increase in rate. We didn't receive the increase in rate that we requested, but we did receive an uplift from 525 to 531. On another occasion, our request was completely ignored. We just received no response. Towards the end of last year, in 2009, it became apparent to us that we would not be able to see out the contract extension without going into a negative trading balance. And it was this that led us to go to the PCTs in December, as we've heard from Liz Wise, in December 2009. You'll have heard reference to the fact that Camidoc has withheld doctors' pension contributions and the contributions made by those doctors. The decision to do so was taken by my predecessor in November 2008. Regrettably, it only came to Camidoc's board's attention in the following year, November 2009. When it came to our attention, we then drew it to the attention of the PCTs and to our auditors. And it's completely apparent that the PCTs knew about that. In fact, I've got an email from one of the directors of finance which says, just preempting a question that I know will be asked and I know why cannot the pensions contributions remain unpaid for a few months more? So I think that's the, beneath what we've heard, there are other forces at play here. We asked for 750,000 in December 2009 as the figure that we thought would see us through till June. It's true, as you've heard, that we agreed a lower figure. I would say that another thing driving our relationship with the PCTs is, although it's a quasi-commercial relationship, it's very hard to see the power balance as being equal. And given that we exist to provide an out-of-hours contract, we either have to accept a figure at some point, or we cease to exist and cease to provide the service. We were not happy with the £400,000. We believed we needed 750, but £400,000 was all we were given. So we had to continue and seek to continue on that basis. And for that reason, we had to cut our fees to doctors, which was a move that, as you can imagine, was not very popular and did not go down well in terms of services. As you will have heard, we were awarded the contract fair and square in competition and we heard about the award in April 2010. I don't think you heard that Harmony was one of the other competitors for the contract. They were. As our understanding, although Liz Wise would have to confirm this, is that 4 people went through to the final stage of the bidding process for 4 providers. Only one of them was interviewed because the quality of the other submissions presumably wasn't sufficiently good for them to go forward for interview, but you'd have to ask Liz Wise whether that was in fact the case. Following the award of the contract, we entered a series, I think we both agree, us and the PCT, of what were torturous and protracted negotiations. The reason we entered those negotiations and drew our financial problems to the PCT's attention was we were of the view that the way the old contract had been managed left us in a position where we couldn't have a fair start at the new contract because we'd be underfunded on the old contract. We were going to start the new contract with either 0 or in fact with a negative trading balance, and it was not safe for us to, it was not simply not safe for us to go forward on a new contract with starting from a negative trading balance. So the strategy for our negotiation was to seek to get more money under the old contract so that we could then start the new contract in fair terms. We reached a position where we received an email from a finance director in one of the PCTs saying that if we signed the new contract, then our short-term cash flow and financial difficulties would be addressed. We took the decision, and it was a risk decision taken by the board, that we would sign the new contract. However, following that, we were then told that the PCTs weren't going to sign it and that they wanted to have this independent financial review. I'm pleased to hear it recognised that we cooperated fully with the review process, and I'm happy to say that we did so. There was a question asked to Liz about whether the contents of that review can be shared with Camden. I can confirm that Camidoc's got no objections whatsoever to being shared. We're all in favour of openness and transparency, so we've got no problem with that. We might want to attach our comments if we did so, but that's all that we'd ask. However, if Liz, I'm not sure of the legalities of sharing it without the permission of the authors. It may be that the PCT want to request that, in which case so be it, but I would have no problem with sharing it. And I brought the headline findings with me tonight if people want to see them. Our contention is that the report actually revealed nothing that was not already known to the PCTs. Both immediately brought their attention in the contract negotiation process and actually available to the PCTs in December 2009. There was a question made about what has been done by the PCTs to ensure that the service continues in the months of June, July and August, and Paul Fox is correct in saying that an offer of money was made. However, Camidoc has not yet seen that money, and in fact, although the offer was made, the offer was then made contingent on, it then changed into being contingent on us agreeing to Harmony taking over at the beginning of September and dropping our legal action. And we feel that the use of an offer of money made to support services that are then being used to force us to withdraw legal action is strong-arm tactics, to say the least. So we're taking legal advice about what we're going to do about that. The key points that I want you to take away is firstly that all our activity is funded in one way or another by the 4 PCTs, and that there's a fundamental perversity in maintaining that concerns about viability are driving our decision when it's the lack of funding, the lack of adequate funding to provide the service that has created the problem in the first place. Furthermore, we weren't offered the opportunity to bid for the new contract, the 9-month contract. We weren't asked how much it would cost, and it would have been in the PCT's gift as the funders to ensure that Camidoc continued to provide that service. However, we weren't given that opportunity. We weren't asked. It also feels to us at the receiving end of this process, and I'm talking about feelings absolutely wantonly destructive. We've got 12 years of local know-how here, local know-how that's invested in people, that's invested in the board, that's invested in local doctors, that's invested in the systems that we've set up. And this is just being wiped out. I think there's very little chance that that local knowledge can be resuscitated at a future date. So although this is being framed as a 9-month decision, I think, well, in effect, the decision that's been taken recently is a permanent decision, and it is a decision towards a private provider, not a social enterprise. I'm not going to comment on whether I think that's appropriate or not, but I think we need to name what is actually happening here so that you can reach your own views, because they are a private company with shareholders who take a profit. That's not a criticism. Companies do that. That's what they're there for, but that is the decision that's being taken. We are also of the view that, that the risks inherent in the transfer of a service to an alternative provider have been inadequately considered by the PCT, and we don't think that Harmony are yet ready and able to take over the contract, although they have done so. A small example is that they're asking Camidoc to run our payroll because they can't run the payroll yet themselves, so they seem to be proposing that they pay us in order for us to pay their staff who used to be employed by us. I would question whether the service is going to be the same. One word that wasn't mentioned by the PCTs was redundancy. As you know, GP requires that people go over to the new provider on their existing terms and conditions. However, it is open to a new provider for legitimate business reasons to make certain groups of staff redundant. And I've certainly spoken to staff who've had one-to-one interviews with Harmony today and over the period of this week, where they are being told either that there will be redundancies or in one particular case that their post is going to be made redundant. Again, that's their right, but I think I'm just letting you know so that you know that that's what's going on, that's what we're facing. I've also been told by a member of Camden PCT's commissioning staff that the service is at some point going to be provided from a call centre elsewhere. I can't confirm that that's the case. I can only assume that that's what I've been told by David Bradley, who is the person who told me that. He's one of the commissioning staff in the PCT. Finally, and I think this will be, this ought to be one of the concerns of you, Chair, and of the members here. The decision-making around this process has been at best shadowy. The first we have heard of Section 414 at Camidoc is here tonight. We've been given no information about who took the decision, when they took the decision, and we've been given some information about why. And we've been presented with essentially a fait accompli, and we also think that in the decision they've taken, the PCT, to bring the implementation forwards to the 1st of September, the rest of the world effectively has been presented with a fait accompli. That includes local GPs, so I haven't heard that they were consulted about this decision, local population, and yourselves as local partners. I think that's about all I want to say. I don't know if the Mayor, you want to add anything?
Chair, perhaps I can just give you a little bit of the clinical work that Camidoc has been doing over the past. And if I can just start by thanking James Hood, who, as he said, has been one of our non-executive directors and actually stepped in as interim chief exec to take us forward with a view to going on an activity-based new contract, which again would have made a lot of difference for our cash flow. If we're doing 109,000 calls on an annual basis, you know, the sums add up and things would have worked out. As you're aware, Camidoc's been there since 1996, has helped over the years in terms of the acute trusts, has helped put in GPs into casualties at the Whittington, at the North Middlesex, at the Royal Free and UCLH on requests made by the PCTs and the acute trust to help with the 4-hour waits. As you know, it also provides service to the local prisons, and more recently was involved in, again, not, you might say, business-wise, a bit naive, but also the homeless service here in Camden. As James has said, the original contract for the GP out-of-hours service was from April 2005 through to the end of March 2008. At that time, we were told that, look, the new contract's going to be coming, and there were 2-3-month extensions given. It was in December 2008, and in fact there is a paper trail that Camden PCT, as the leader of the consortium, was sent a 3-page letter with the breakdown saying we do request urgent review of the rates. James has outlined the rates to you, and actually there hasn't been any contact that's been made. So I just need you to all be aware of this. The problem, as I see it, is that really there hasn't been an equal playing field in terms of commissioning and provision over the period of time. But more worryingly, for me as a GP in the patch, I think that a valued local, and again, we've not bid for anything else outside our boroughs. We work really well with the other co-ops in the area, PELC on the east of the borough, east of our borders, and LCW on the west of our borders. And so we've not bid for anything else in terms of contracts. We're not in expansionist mode. But I think that this accelerated gagging of Camidoc, a valued local out-of-house provider, to me that sucks, really. And so I think that you need to seek some answers.
Colleagues, who would like to start the questions for Camidoc? Any immediate... yes, I'll Paul first then.
Thank you. Rather a sad story. I think you're both directors of Camidoc. The implication that we've heard earlier was that the business case said that you were insolvent at the end of May. I'm not aware that you operate any other service than the out-of-hours service to the 4 primary care trusts. So, as directors, it's an arduous responsibility to not trade whilst insolvent. I believe you've issued a pre-action protocol, so you are exploring whether to judicially review a decision that you think may be legally flawed. But I'm wondering where today, how many has taken over this service? Do you have a business? Are you trading satisfactory at the moment? Have you received the funds that you have been promised by Camden NHS for the transition period through to today? And on the assumption that you have now lost the service, what becomes of Camidoc in the weeks ahead?
Okay, I'll try and answer all those questions. The first thing is our position as directors when we're trading, when we are technically insolvent. We've taken advice from an insolvency practitioner, and our advice is that as long as we don't actively worsen our trading position, we can continue to trade. So while the offer from the PCTs to assist us with the trading losses in the months, in the past 3 months was on the table, we could then lawfully trade. However, to answer, it may have been the second or the third of your questions, we haven't yet seen any of that money. We haven't received any additional. We've been paid the contract price, I hasten to add that, but we've not received any additional funds that have been undertaken to give to us. And you have heard that, in fact, in our view, unlawfully and inappropriately, those funds were used. The possibility of those funds were used to strong-arm us into taking a different kind of, to agree to things that it was inappropriate to use them to do so. As to what happens next, Camidoc will undoubtedly go into liquidation. That's what will happen. We will do it we're in discussion with an insolvency practitioner, and we will do it in an orderly fashion. We can do it in an orderly fashion, and we would want to ensure that all staff are TUPE'd across to alternative employers, so we don't have to make anyone redundant ourselves. We want to make sure that all staff have been paid for August, which they now have. It takes us a few weeks longer to pay the doctors, so we're going to do that first. And we also want to, we still haven't clarified the individual details of exactly what our responsibilities are in terms of the arrears of each doctor's pension. We're not going to be able to pay that. We haven't got the funds to pay that. So that's going to have to be dealt with through the insolvency process. We'll be able to pay some of the pensions arrears, but not all of them. But what we want to do is to be able to give each doctor a statement of their exact position. And we've been in discussion with NHS Pensions, and they've told us that as long as a doctor can demonstrate that the deductions from their pensions were made, then NHS Pensions will honour their pension.
Maya comes in next, and then Peter.
Yeah, I just wanted to ask you 2 questions. The first is relating to this issue of there being some sort of risk to healthcare in the borough if the contract had been awarded to you. From what you've... Anyway, I'm just going to put this question to you. I mean, can you tell me what risk you think there would have been to healthcare if the contract had been awarded to you? Was there any risk? I'm not sure I can see what it is. And the second question is that we were... Liz Wise has said that the contract, if Camadoc had been given a 9-month contract, it would have been 20% more expensive. Can you tell us if that's correct, or whether you think you could have provided it on the same terms, at the same price as Harmony? Thanks.
Okay, to answer those, the first question, we thought that there were financial risks associated with us taking on the 3-year contract, and for that reason we sought to receive what accountants call headroom at the start of the contract to enable us to manage those financial risks. We don't think there would have been any risk to healthcare. The worst thing that could have happened if we'd gone forward with the 3-year contract is that at some point we might, down the line, we might have had to say to the PCT, I'm sorry, we can no longer manage this financially. Thereupon, what the PCTs would have had to do was enter an emergency tendering process, choose a few providers, and then select one of those providers, which is exactly what they've done now to prevent that happening. So there's another kind of perversity. In order to prevent the risk of what they see happening at some point in future happening, they've made it happen now, which seems perverse to me. In respect to the 20%, I can't say, because I don't know what price Harmony have been agreed between the PCT and Harmony. I think it's likely that Camadoc would have been more expensive, and the reason it would have been more expensive is that another thing we negotiated with NHS pensions is that in order to clear our pensions arrears, they would agree a write-down period of just over 2 years. So they would have given us till December 2013 to clear our pensions. We would have had to include the cost of doing that in any bid we made, and therefore we also have, because we're a local organisation, we have to have the same kind of clinical governance overheads as Harmony has. Harmony are a large national organisation. They can deliver value for money through centralising payroll, through centralising finance. We have to have all those functions, and we're a smaller local organisation. So I think we will always struggle to compete on costs with an organisation of that size. And we're also... We, as a small organisation, inevitably face greater financial risks because we've got no other contracts to cushion us and to fall back on so we can spread the risk out across the range. Because Harmony obviously will be able to spread any risks associated with this contract across their £70 million business. We can't do that. So we have to accept that we will always struggle to compete on price.
Sorry, I just wanted to follow up on the point of the 20% of the cost being 20% higher. I'm possibly asking you to speculate a little bit, but do you think your costs could have been higher because you do things like pay, give your staff pensions, perhaps quite generous pension schemes, and companies like Harmony don't?
That's certainly a factor. Yes, we do, and most I'm not aware of any private provider that still pays pensions. They have a duty when they GP staff over to offer a comparable pension scheme. So they're going to have to do something for the staff they're taking over, assuming they continue to employ them. But they're not part of the NHS family, which we see ourselves as being, and what we pay as an NHS pension. And I think most private pensions actually aren't comparable to NHS pensions. It's something we see ourselves as wanting to do.
Peter, briefly, if I may.
Okay, Chair. Well, just a very quick comment, then a question. It does seem to me as though it's now possible for Harmony to have put in even a loss leader in order to expand their business. They have been on a growth profile for a number of years, spreading geographically and spreading into whole new areas of activity. So I think they may have been able to indulge in even predatory pricing, I think, is the a technical term. I'm very sorry to hear that you are now facing the prospect of liquidation. And I think the whole of Camden and the members here and the members of the public will be sorry to hear that, and very sorry to learn that the expertise, the know-how that's been built up over a number of years is now at risk of being lost forever, and that the 9 months is going to almost inevitably turn into a permanent situation. The question may seem a little bit technical, but it really relates to you as a social enterprise, and the sheet that you've just given us goes into some detail on each year's rates, call volumes, and a line called retained profit. And if you add up those figures for retained profit, which I suspect is a little bit obscure to some of us at the moment, there is a total there. Is that reserves that you had built up? And would it have been possible under some other circumstances perhaps to use any reserves to continue your offer to the 4 PCTs concerned?
I had a very similar question, but I think the retained profit actually is what I would call a traditional carry forward from one year to the next. In other words, it reached a peak at one point in 2007 at 1.5 million and then slowly went down again. But Callis, you did seem to suggest earlier in your presentation that when you made a profit in the early years, you seemed to give some money back to the PCT. Now, that's what's confusing about these figures, I have to say, because I saw them briefly earlier this afternoon, and I didn't know what retained profit meant either. So can you explain in sort of lay terms what you mean by retained profit on that line?
Yes, you can't. It's invalid to add the whole lot up and reach a sum. It's what we carry forward from one year to the next. So, in the first year, we brought 412,000 into the contract. By the end of 2006, we had 1,346,000, and on the basis of that, we didn't give money back. We offered a rate reduction to 525. Which, with the benefit of hindsight, was a very stupid decision, given what happened later, but it was the decision we made. And the other thing I would say about these figures is that they don't include any provision for bad debt. Bad debt is money that you have in your accounts as recoverable from other people, but actually you've got very little prospect of ever actually recovering it. And our bad debt provision, we think, is somewhere of the order of 150 to 200,000. So that comes off these figures. And the April 2000, and I can't do the maths in my head, but the April 2000 figure is more likely to be minus 100 and something thousand.
My one follow-up question about the story so far, as it were, was the fact, I think you may have got the dates slightly wrong here, but you said a previous incumbent in your particular office decided, without telling other people, not to pay the pension contributions for a while to keep the money presumably flowing through the accounts. But it wasn't picked up for a year. And it wasn't actually picked up by your auditors either until you told them. That's rather worrying that you had auditors who could not find at the end of a financial year, which I think was 2007-8, that payments due to the usual NHS pension provision had not been made. I don't know whether you want to reveal the name of your auditors tonight, but that is pretty poor management in 2-3 years ago, which has led you to this position.
Yeah. And perhaps I can expand. I mean, my predecessor took the decision because of cash flow difficulties. He wasn't getting in payments quick enough to meet his outgoings. And at that point in time, it would theoretically always have been possible, if he got in all the money due, to actually pay the pensions. So it was an incorrect decision, and in fact it was an illegal action. I don't think he realised that. He also believed that by the end of the year, the problem would have resolved itself because the payments would have come in, and he was taking steps to get paid more quickly. History tells us otherwise, and that's not what happened. In terms of the board not knowing about this, I think I would have to say that our financial scrutiny in those days was not as rigorous as it ought to be, and that is one of the conclusions of the report prepared by Grant Thornton. we've taken steps to address that and recruited new staff and so on, but obviously that's closing the door after the horse is bolted. In terms of the auditors, the year that the decision was taken was the year 2008, 2009, and the auditors didn't start their audit process till November 2009, so they started rather late. And I think I was incorrect in saying that we told the auditors they found it at the same time. They found it at the same time as we were told. However, I'm not going to mention their names, but they did not qualify the accounts or mention this as a point of concern in their management accounts.
Colleague, I think we're so way over time, Paul, that I'm concerned now. You might want to bring some conclusions to this rather than more questions. Is that what you want to do?
And it is a concluding remark. I'm profoundly sad to have you confirm that this is the death of Camidoc. And in terms of social responsibility, it is a social enterprise. We as councillors care, hopefully at least as much as your doctors and your principal statement at the beginning. And I hate the expression learn lessons, but it does seem to me that there was an opportunity, and it has been missed, for this social enterprise that is hugely valued and will be a terrible loss to the community, to Camden, that at no time were we aware that it was in jeopardy, and the first we knew was from the local paper. Now, I think there has to be some more joined-up solution, and you know, I would have hoped that Camidoc could have come in some form to Camden and worked out tripartite with the Camden NHS some more constructive way forward than where we find ourselves tonight. So that's my observation.
Can I perhaps just answer that by saying that today is Wednesday, and it's exactly 4 weeks and 3 days ago that James Hood, with Mary Elford, who's our late chair of Camidoc, and Marriott Davis, who is our non-executive finance expert, went to NHS Camden at James's request with a view to signing the new contract. As James has said, we have actually gracefully thus far dealt with everything, including cooperating fully with the independent review, only to be actually told that A, Camidoc weren't going to be given the contract, and B, that we would be given this extension to the 30th of September. Now, it's in this month of Purdah in August, while everybody has been away, that all of this has been gagged. And 1st of September, we have a new provider today. And I think that that really needs scrutiny.
Liz has indicated she'd like to perhaps have some concluding remarks as well on what you've heard so far from our Camidoc colleagues.
Thank you, Chairman. I really just wanted to make a couple of very, very specific points, because I don't think it will help us to start wrangling on this occasion. But there just is a point on which I wish to be really, really clear with the committee, which concerns the withholding of pension payments and who knew what and when. It is the case that it was clear in December 2009 that the employer's contributions were on the balance sheet as owing to the pensions agency, and that the PCTs were made aware of that. We were not aware until the Independent Financial Review reported that the employees' contributions had also been withheld. And I think that there is quite a difference between holding on to the employers and passing them over, but keeping part of the employee's salary and not passing that over. And I do want to be very clear. I did say that in my presentation, and I wasn't sure maybe whether I'd been clear enough about that, but we were not aware until the report that you have asked to see that the employees' pension contributions had been held back, and we did regard that as a serious issue. I'm, needless to say, I'm uncomfortable about I'm uncomfortable that suggestions have been made that we have in any way gagged anybody, and I'm very happy to take that outside and discuss with CamiDoc why they feel that there's any gagging. I really don't understand that, and it makes me uncomfortable. I think the other thing that I just wanted to say is that from NHS Camden's perspective, we would be happy to publish the independent financial review. We would need to ask, as I said before, the authors of the review. We would want to consult with the consortium because, as we do have to remember, we are the agents of the 4 PCTs. We are acting as the commissioning lead for the consortium, and all the decisions that you have been talking about and discussing have been decisions of the consortium enacted by NHS Camden, not purely by NHS Camden on its own. Thank you for the opportunity to clarify those matters, Chairman.
Yeah, thank you for that. I think one obvious conclusion we might make, committee, I don't think there will be a controversy about that, is that we would certainly urge you, if you can get all the right agreements with everybody else, that we get that review in the public domain so that everybody can look at it who's taken an interest. It's a lessons that are learnt issue, which I think is also of concern to me. We've got a social enterprise, which I think most people in this room, from wherever they come from, would instinctively think, well, you know, a cooperative between GPs ought to be the best model for providing services. However, there are lessons learnt that GP cooperatives can make mess-ups of their finances as well as anybody. And they've already admitted that perhaps they ought to have been a little bit more financial scrutiny within their own board membership of how they were operating financially. And it seems to me that any organisation, whether it's in the private, public sector or voluntary sector, that is spending public money, need to be more open and public about how their finances operate. So they can be answerable to not only through own scrutiny and governance arrangements, but possibly through scrutiny arrangements in places like this. Because whoever is spending public money, they ought to be answerable somewhere to the public through local mechanisms such as this scrutiny committee. And I think that's one of the conclusions. It's a sad story that we've had a cooperative which has not managed its finances properly and possibly didn't alert, or the PCT were not, let us say, didn't react as fast as they possibly could 2 years ago when these problems were beginning to arise. But nevertheless, it's because of possibly the lack of information in the public domain which leave these things to linger. And that's why I'm always at the cusp of asking people, put things in the public domain, let's make sure the public money is scrutinised properly, and if any institution is wasting money, misusing money, losing money, we ought to know about it, because it's our taxpayers that are actually paying for it all. So that's another part of the conclusions. But I think in terms of the independent review, we'd certainly urge if we can get around all the permissions to get that published. That is one thing we would like. The other thing, I think we can take this lesson into the next debate, because the whole principle of GP commissioning going forward, when we've had, unfortunately, this sad example of GPs not managing the finances well, doesn't augur well for GP commissioning, I have to say. And that's my first instant reaction of somebody who, in other respects, might support the coalition government, but on this instance I don't. Maya, did you have any other conclusions from today, from this debate?
Yeah, I wanted to make I wanted to just make one point, which is really about the future, really. I mean, I think it is very sad that CamiDoc looks as if it will have to go into liquidation, but when this contract is tendered out again in 9 months' time, I would like to see the PCT or whoever it is encourage a group of doctors, a collective of doctors to come forward. And I think people here do want to see that social enterprise model, if that's at all possible. And I think the community does too. So I think I'd like, as a committee, to register our support for a social enterprise type model and ask the PCT to try and encourage that sort of model, that sort of collective to come forward and make a bid. Thanks.
I'm comfortable with that. Peter?
I agree with what you said, Chair, in summing up, and also with what Maya said about what happens next time around. And I do hope very much that next time around won't be a foregone conclusion, as James has alleged it is almost inevitably going to be, and that there will be a proper level playing field between a range of different potential providers in the commissioning process. So I'd add to what Maya has said, the hope that this committee be involved in the specification and the procurement details before the decision is taken, so that we can have a look and make sure there is a level playing field. I think there's also a wider issue where the PCT have said several times that they had to be blind to the nature of the provider. And I think there are quite significant dangers in that, and we'll come on to it in the next debate about the white paper, because it is, as I said earlier, quite possible for there to be short-term predatory pricing by large companies that are able to subsidise or cross-subsidise a low bid in order to gain some territory in a long-term game of ever expanding their provision. But in the long run, for the whole of the NHS, that's not going to deliver the services that are needed, because there'll be a day of reckoning. And I think whatever the future commissioning arrangements are, there should be an ability for the commissioners to have regard to some of those wider issues of the nature of the providers, the value, whether it can be monetarised or not, of local know-how, social enterprise, cooperatives, and that those factors, as opposed to whether it's American-owned multinationals, homegrown large companies or whatever, can be taken into account in the process of commissioning.
I hear from outside that request. It hasn't been brought up in the rest of the debate. I'm also conscious of the fact that we've got potential legal proceedings taking place, and until that is clear, one way or the other, I would be reluctant to do a referral, because I think there are good financial reasons, as explained, why Camidoc actually went to the PCT and explained their financial position, and it's quite reasonable for the PCT to think, well, you're not financially sustainable to actually run a contract for a 3-year period. I don't think that is therefore a good reason to go to the Secretary of State for a reference. But I think the lessons learned that we've already outlined and members of the committee have outlined are clear for the future. But I don't see what a reference to the Secretary of State will achieve, to be honest, under these circumstances, because I've had no request from a member of the committee for a reference, and therefore I'm not accepting that as a way forward. I think we do need to move on. We've now lost a whole hour extra on the Camidoc debate than I originally anticipated. So we do need to move on to the Wealth White Paper.